Hi, I'm Laurie Sehn. I'm one of the medical oncologists from the BC Cancer Agency. I'm here at the Canadian Hematology Conference. And today at the meeting, we were discussing follicular lymphoma. We discussed it from all aspects and had a detailed discussion on the evolving understanding of the biology of follicular lymphoma, how certainly it's much more complex than we originally realized. There's a heterogeneity between patients that makes them very different. Some patients respond well to therapy, other patients respond less well, and the real trick is going to be to have a tool that allows us to measurement this biology in individual patients. So certainly there's a lot of research going on in this realm right now, but in terms of a clinical biological tool, that's probably a little ways off. We also discussed the current standard of care in follicular lymphoma. For the time being, that will likely continue to rely on chemoimmunotherapy. Standard across Canada now tends to be bendamustine and rituximab. Rituximab, of course, has revolutionized the treatment of follicular lymphoma, leading to better progression-free survival and overall survival. And of course, we discussed the recent trials exploring the value of obinutuzumab, now with the gallium study in the upfront setting showing an improvement in progression-free survival for untreated patients with follicular lymphoma, which may make its way into the standard of care. And the GATOLIN study looking at the addition of obinutuzumab to bendamustine in patients with rituximab refractory disease, actually demonstrating an overall survival advantage in the updated analysis of GATOLIN. So this will likely make it onto the Canadian scene and become standard of care for rituximab refractory patients in combination with chemotherapy. And then finally, we discussed a variety of exciting agents that are coming through the pipeline right now, targeted agents that are targeting various aspects of lymphoma biology, some of which are already on the market in other lymphomas, such as ibrutinib and venetoclax, agents to be considered. But clearly, we've got a long way to go in terms of understanding where these agents are going to fit in. It's just exciting to see that some of them are showing real promise at this stage.